In this session of Alberta Healthy Living Program's video series, Helping You Feel Better After COVID-19, we'll cover the basics of long COVID treatment. You may be wondering, what's the best treatment for long COVID? Well, there isn't currently a known cure for long COVID, and there isn't just one thing that will improve all of your symptoms. What we understand about the best approach continues to grow as we learn more about the condition. And a lot of the recommendations are based on other health conditions with similar symptoms. Let's start with some global recommendations, meaning they apply to everybody. Everyone should receive information on taking care of yourself, also called self-management. Ask for advice from a health professional, either in person or by calling HealthLink or the Rehab Advice Line. Search online for information about managing long COVID. You can check out the website links listed at the end of this video for some reliable sources of information. We encourage you to continue watching the videos in this series or consider attending the Alberta Healthy Living Program Zoom series by the same name, which covers a number of topics related to COVID and provides advice to help improve your recovery and your quality of life. Managing your energy is an important part of long COVID treatment. We know that rest is an important part of recovery, but it's important to aim for restorative rest, which means you rest your body and your mind. It helps to reduce sensory stimulation, so try to limit screen time and try to choose activities that bring about relaxation and reduce stress. Even with ample rest, you may find that you still have extreme fatigue, so take frequent breaks throughout your day and find time to recharge. You may need to balance your activities with rest, which is called pacing, and plan or prioritize activities during your day. Taking action to manage your symptoms, which means monitoring your symptoms and taking the self-management advice and applying it to your situation, like learning how to pace or planning time in your day for breathing and relaxation exercises, or finding other tools to help you manage day-to-day, is something else that everybody should do. While some manage well with information and self-management skills, some people require an additional helping hand. You may need to be followed more closely by specialists and need additional medical support. If you spent time in hospital with acute COVID-19, ask your healthcare provider about scheduling an appointment about 6 weeks after discharge for follow-up. It's also a good idea to check in with your care provider if you're struggling with daily tasks or worried about your mental health. Anyone with ongoing symptoms can also ask about referrals to a long COVID clinic, mental health supports, or other community services in your area that could offer help. Some people who are returning to the workforce may need to talk to their employer about taking small steps and phasing in their return to work. Physical jobs and ones that require mental concentration or entail a lot of time spent looking at a computer screen can present challenges for those with ongoing symptoms. See if you can reduce your workday or break up the activities, changing from physical to mental tasks if possible. Some employers can also offer modified duties if you can't do the things you used to do. It's helpful to have support from your doctor when making a return to work plan. If you continue to struggle with what you're able to do day to day, you may require more targeted rehab, as self-management may not be enough to get you back to your pre-illness level of function. Talk with your doctor to see if this is an option in your area. Rehabilitation programs include individualized care by a number of different health professionals and could include physical therapy to help regain your strength and mobility, occupational therapy to help you with your daily activities or prepare you to return to work. It can also address other issues like retraining of breathing patterns, voice rehab, or managing the changes in thinking and memory that come along with long COVID. There are other treatments that may be recommended but warrant some caution, as they may not be appropriate for everyone. Exercise may have been prescribed after COVID, or perhaps you were someone who exercised before. Be cautious though, as exercise is not appropriate for everyone and may be harmful, especially if you have symptoms that are made worse by activity. If you have symptoms of breathlessness, even at rest, extreme fatigue, dizziness, or a rapid heart rate, ask your healthcare provider to investigate before starting or resuming exercise to make sure it's safe. You may also want to seek additional guidance and support if you're new to exercise had difficulty moving around or had falls before COVID, or have a pre-existing chronic health condition. If you were exercising regularly before getting COVID, it's recommended to scale back and modify the exercise you're doing and slowly build it up over a period of time. Another treatment that you may have heard about are over-the-counter vitamins and supplements. Not enough is known about whether they're helpful, harmful, or have no effect in treatment. It's best to talk to your healthcare provider if you're thinking of adding something new to your regime. Everyone with long COVID has a different experience in their recovery, so choose the treatment and self-management suggestions that work best for you. If you need direction and support, work with your health provider to make a plan that addresses your needs, or visit these resources for more information.